The Soweto Retired Professional Society was established in 1986 in response to the crisis in the healthcare services in the country. Retired nurses and teachers formed an organization called Footprints. Shocked by the devastating effects HIV/AIDS was having on families, they established a hospice in Orlando East.
We are saying to the community, when you have problems, when you don't know what to do with your sick person at home, we, the Soweto Retired Professional Society, will literally carry you on our shoulders and assist you in either caring for this person physically or assist you in building relationships between the sick person and the family, and also assist in managing the spiritual care of the person.
Everything is in.
Yeah. Elizabeth Mhlanga is one of the many people Footprints has carried on their backs. She was discharged from Baragwanath Hospital and sent home to die. Her neighbor, not wanting her to die at home in front of her 7 children, took her to the Footprints Hospice.
It was like I was in a coma because I couldn't eat, couldn't walk, I couldn't talk. I was just sleeping all the time. I was weighing a 24 kg for a 5-year-old child. I was vomiting, having diarrhea, having sores all over my body. After 1 or 2 to 2 months, they started at the hospice trying to force me this lot of cereals. All the time when I was sleeping, I was calling my children. So one day they wake me up and say, Elizabeth, you want to see your children again? I said, yes. They say to me, if you want to see your children, you must start eating. You must gain weight, you must gain your strength. Don't throw the towel, it's too early. The people who are working at the hospice, they are well trained because they don't give up on you. I understand that the hospice, that's where the people are dying when they chase from Baragwanath, but that one, it was a different hospice.
If the patient believes in herself or himself, when you come to him and explain and try and work with him, if he really believes that this is going to help him, then we have a way forward. But if the patient himself is negative, then there's nothing that we can achieve in there. The success we have is because maybe we boost them up, because they have people who look after them day and night. They are really listening to their ears.
And it was my first time when I The
Soweto Retired Professional Society has 52 members. They are retired nurses, teachers, social workers, and ministers of religion.
The average age of the members here is ranging from 60 to 72 for the people who are active in programs, in whatever program, be it the hospice, education, or home visit support for people living with HIV and AIDS. But we still have 2 members who are between 82 and 84, who were founder members of the organization in 1986.
I am retired but not tired. Why should I keep my knowledge in myself and not do something? I must return it to the community and try and help the needy.
Hi, Cindy.
How are you?
Fine, thanks, and you?
Hi.
What can I do for you?
Just when we opened our hospice, we realized that if we were to tackle the HIV and AIDS scourge, nutrition was playing a major role. So we sought services of a professional gardener who was going to do organic farming for us.
It's so important to have this garden because it's in a healing process for the people who are sick up there. They eat fresh vegetable from the soil, and we are organic. With the herbs, like rosemary and stuff, we put them in the food, cook them. They help with a lot of nutrients. They help with the immune system. In our garden, we make sure that pesticides, we don't use chemicals. We put khaki balls in the water, and we use sunlight soap. Rosemary is good for the brain. Okay. You can make... Elizabeth used to visit the garden. It was part of her exercise. She used to come up here, and then we taught her how to plant and taught her what are the herbs for, are they for. And then I used to help her to transplant her own garden at home.
We believe we need now to extend the service, and if we discharge people like we discharged Elizabeth, we need to follow them up at home.
When we wrote out our constitution, we said we are a resource group because we come with a lot of skills, and we offered to help the other home-based organizations. Because some of the home-based organizations, people have given help just out of the kindness of their hearts, and they don't have the knowledge or the know-how to do it. So we said, here we are retired, we've got lots of information which we can share with you. Then the government got to know about us. Then they said, can you mentor and supervise? And this is how the whole thing started.
Was watching me there, I was
Yes.
and then
Home visits are very important because we have to keep contact with the patients we have discharged to make sure that they comply to treatment. We have to look at the environment. Is the environment conducive to their health? We look at the physical status of the person because a person may deteriorate.
We identified that the very caregivers that we employ are too young to be left as caregivers for the rest of their lives, and therefore provide career ladder so that they could progress within the nursing profession.
The caregivers are a very, very important service because they've come to close a very big gap that has been left by the government or health givers, because when patients get discharged from hospitals, there's no nurse that's going to come from the clinic and continue the care of this person.
This training is addressing the shortage of nurses in the country, and the caregivers are providing needy patients with support around taking ARVs effectively.
We felt we were leaving a mark and landmark. We're putting our footmark on the ground. We feel that we are transferring skills for now. We would like other generations to follow our footprints and do something to assist.
All the knowledge I've got it from the hospice, I'm still using at home. And is that knowledge keep me strong, healthy, and my CD4 count is still going up and up every day. And the doctors in Bara, they are amazed and happy about my health. But I learned something from hospice. You taking ARVs, you must eat proper nutrition. I can even advise most of the people when they're sick, they must approach the hospices, especially the one that I was in, Footprints Hospice in Orlando. Those people, you can depend on them.
Good girl, yeah, boy.